Out of precaution, Jessica Mcinnis-Norman was tested for 37 cancer genes. Though she has a family history, Jessica didn't carry any. But on August 10th, 2021, she found out she had stage 1 breast cancer.
Was unexpected, just being only 42 years old, and my grandmother and my aunt were not diagnosed until they were 52.
Doctors diagnosed Jessica early on, but they needed to act quickly.
Because I'm HER2 positive, ER positive, and PR positive, I had to start chemotherapy treatments immediately.
Jessica had treatments once a week for 12 weeks and worried about what the drugs would do to her hair.
The only thing I was concerned about going through all of this, when my surgeon told me that I was gonna have to go through chemotherapy, that was one of the top things that I was worried about.
When it comes to concerns about hair loss, Jessica isn't alone. One doctor at the Falck Cancer Center came across a study with some unexpected statistics.
50% of the patients says that they consider hair loss is the most traumatic side effect of the chemotherapy. In that study, they say about 8% of patients decide not to receive the treatment because of that. And so it was a really shock to me.
After talking to a friend, she found a way to freeze the unwanted side effects in its tracks.
So you put it on and kind of fit it to your own head and then Velcro where you need it to be tightened. And then on top of the actual cold cap, you put a swim cap on. And then you put almost like a winter hat over that.
Arctic Cold Caps, the company that made Jessica's cooling hat, claims the freezing temperatures prevent chemotherapy medication from reaching the hair follicles. The process wasn't short.
I needed to have it on for an hour prior to treatment, and then during the whole treatment, which usually lasted about 2 hours, and then I had to wear it for 4 hours after treatment as well.
Wearing the cold cap isn't enough to stop potential hair loss.
I will wash my hair once a week and straighten it once a week right now. All your hair products have to be all natural, so I had to buy all natural shampoo and conditioner and all natural leave-in conditioner, so anything with alcohol in it you can't use on your hair.
Jessica says adjusting her daily beauty routine wasn't easy, but she felt she needed to take control of this aspect of her life.
I have 3 children and a husband, and so being sick, I feel like, is portrayed more with the hair loss. So I kind of wanted to keep my identity with keeping my hair.
Jessica finished chemotherapy in November, and with the help of the scalp cooling system, was able to keep a full head of hair. And Dr. Dauphin believes it could help other patients who need chemotherapy.
When we're treating patients, we should really seeing the whole holistic view of the patient. So mental health, that's very important. Self-esteem, that's very important. And from now on, we cannot really continue like the way we used to do. So we have really to look at this thing and see if we can really offer that service to the patient. So I don't know.
For Arnett Health, I'm Lexi Cutmore.